most of this.
Okay. If that
Hold on
works,
just a second. Thank you.
I think that's fine. If the judge, when he gets here, if he's comfortable with that.
Okay. I do have a question for you. Do you send all the stuff that's on the screen out separately?
We can. The
Well,
graphics,
have
you
you?
mean?
I mean, I'm just trying to figure out if I need to show it in any shot or they're gonna get it separately and they can put it up whenever they want. Hey, do they usually just do, the judge and the, do they usually just do the judge and the signer, or do I show the screen too? Do you guys get the graphics separately, or? Okay, so just the screener, the signer. The what? Oh, and the screen? Okay. Okay. I'm just gonna put the judge way over on the side, but that's all right. Okay. Look. Are you looking at the screen right now? Yeah. Okay. The judge is here. We were thinking about putting the signer right. Are you the one that does the sign?
He's going to be on screen. He's going to be the one in the shot. So typically he stands on this side of the screen. The screen is scooted over a little bit, and he's on this side. So the judge and the signer are outside.
Okay. I guess he's going to stand on the other side of the screen, so that makes it a moot point. All right, bye.
Yeah.
No.
Yeah, no. No, down outside, like we normally do.
I mean, it doesn't matter to me. It's just, but. I mean, obviously then the screen will be in the shot. I'm shooting it for all the stations, so I just want to know how they want it.
So typically, we have the podium and the judge. The screen is scooted over slightly, and the signer's on the outside. So you're getting this part of the room. That
And
part
that's
of the room
usually
doesn't
what
matter.
goes out to everyone.
Yep, that's what's the live feed that everybody pulls from. So the same way since we started this in March.
Okay. Be fine.
Hi.
Sorry, I don't know you.
Personally,
how are you?
Good.
Nice to meet you.
Yeah, call from the Dallas.
You two know each other?
How's everything?
He was a phenomenal guy way back.
He bowls better we're gonna get.
Okay.
Not in here.
Exactly. That's good. Good.
Yeah, he has an office here that we can go to. Just for me, not for
Sure. Yeah, let's see. Of course, I would like to have something in mind. Yeah, for like represent him, so probably the office will work. Outside, I didn't see anything compelling, like,
I think I'm.
just a building, I didn't see anything. I mean, I'm gonna have action shots today, just, to film him and this, but yeah, definitely we can go to the office and see what we can get there.
Cool.
Alrighty, really, you can take.
How's your?
Yes.
I mean, should we go ahead and roll the monitor over a little?
Hey everyone. Let us know when you're ready. Give me the thumbs up. You guys,
Hold on just a second.
sure.
We're gonna bring this screen over a little bit so we, not so wide showing him.
Okay.
Is that okay? Oh, you over just a little bit.
move these up just a hair, fellas, so I can get, if I can. Yeah, so I can get this here, great. All right, y'all ready?
Yeah.
Okay.
Great. So, thank you everyone for tuning in today. I'm gonna try to leave my paper mask off and take this one off in the hopes that you can hear me a little better. So I'm wearing my mask today, and you'll see Dr. Wong wearing his as well. And this is due to a change in the CDC guidance for being indoors outside of your own home. What we're now learning is it's possible for COVID to spread even 20 feet in a conversation in an indoor area. And so the CDC is recommending that when we are around people other than our own families in our home, so when a neighbor or a repairman is in our home, that we're all masked, all right? And that when we're at work, we're all masked. They were finding that there was a way to spread it even if you're in your own office because of the ventilation system. So that's just something that we're doing, and it's something that points to the challenges that we're seeing right now. We're going to go through in this press conference some good news about vaccine arrivals and a lot of not so great news about the new medical models and where we are at our hospitals. But let me start off, for those of you who tune out quickly, with news you can use to stay safe this holidays. I am very, very thankful for the opportunity to serve you. I'm very, very thankful for the courage that the people of North Texas and the wisdom and the common sense that the people of North Texas have shown this year as we've worked together to battle the COVID virus. Okay? And the holidays are certainly a time of joy and Thanksgiving, and a time to practice intentional thankfulness. And it's something we look forward to every single year. But as we said prior to Thanksgiving, we recognize it can be hard to change these traditions. But the facts are clear to the doctors that we need to not celebrate our holidays with guests coming to our home. We need to try to keep those celebrations down to the people that we live with. And because we don't want COVID to be an uninvited guest this holiday. Now, the thing to remember is the holidays can still be meaningful and filled with joy and filled with extended family on Zoom and in all sorts of ways. But we've got to plan ahead. We've got to think ahead. If you'll think ahead to how are we going to replace those Christmas traditions of all of the nephews and nieces listening to a person read the Christmas Carol. If you know what your Zoom is and everybody knows how to get on, you can still do that tradition. And as we think about our holiday shopping or any shopping, I encourage people to shop locally. And do you know that if you will go online or you'll call your local stores, or for that matter, you'll call anybody, the big box stores too, they have a curbside option. I know it's fun and it's part of holidays to go to the mall or go to the big box store and, see the crowds and see the decorations. But at the same time, the doctors are strongly recommending that we avoid those crowds. And so if we think ahead, there's still an opportunity to do that with online and curbside. And it's important to remember to wear our mask 100% of the time when we're outside of our household and not outdoors in a setting where we can be 6 feet away from other people, such as when we're out, walking or exercising. Additionally, the doctors are recommending that for those people who don't follow their advice to gather with people outside their homes, that any gathering be done with as small of a group as possible, and outside being far preferable to inside. I will tell you, on a personal note, my Christmas I will celebrate with just the people who live in my home, as far as being there with them, but we will do Zoom and we'll do all kinds of things to reach out to family and try to make it as meaningful as we can. So there is still a risk, even if we're outdoors. There's a risk if you haven't quarantined for 14 days before you're gathering. There's a risk even if you get a positive, or not a positive, but if you get a test for COVID. Now you can get those tests, and if you want to get those, you should get them, say, 3 days before your gathering, because you want to get that back before the gathering. But even so, there's a possibility of being asymptomatic at your gathering. I recognize, and we all want to recognize, that this situation can be hard. You may have a single grandparent or older person who lives by themselves and will be alone for the holidays. The doctors would encourage, and I would agree, that for people who are in a high-risk group, like our older folks, our diabetics, our obese, our people with hypertension who live alone, the safest thing is to share love with them, drop a dish off at the porch, be on Zoom, send notes of encouragement and love, and not get together. But if we have decided that we don't want to take the doctor's advice on that, and you're going to bring that single older person into the family unit for a celebration, similar to what we talked about at Thanksgiving, choose that that family. So let's say you've got one family where the parents work outside the home, and they're essential workers, they're around other people, and the kids are going to school. And another family where it is a single person, or maybe a married couple that don't have kids and are able to work from home. Choose to bring your elderly person, if you're going to do that, which is against doctor advice, into the home with the people who work from home and have no kids, and not the more active, out in the community family. When you do that, they recommend that if you're going to have those family gatherings, that you're sitting at different families are at different tables. So grandma's over here at her table while her mask is off and she's eating. You can still see each other and certainly talk from that distance. Better outside than inside. And you and your family are at your table. And there's a full guidance at DallasCountyCovid.org. But we're going to talk about the specific facts and models in a moment and for Dallas County. But at this point, the facts are very clear. The facts are that masks work. I talked to a doctor today who was a little frustrated about masking. And what she said to me is, how can people say that they are supporting us when they won't wear their mask around other people? And it's really a good question, right? I've heard people talk about on masking their right to not wear a mask, okay? And you certainly do have a right to not wear a mask. But in our society, you have a right, for instance, to smoke cigarettes. But that right does not overcome the right of other people to not have your secondhand smoke blown on them. And that's why in restaurants we don't allow people to smoke around to where it's breathed by other people. And another example would be when we drive our car, we have the right to both drink beer and drive our car. But we don't have the right to do those two things together, because a person's right to enjoy an alcoholic beverage is secondary to the people that they may hit with their car if they drink a bunch of alcoholic beverages and then drive. It's the same thing with the mask. You've got a right to not wear the mask, but please do that around no one else, because really, when we think about it, the situation that we're in right now is it's a time for patriotism. And when we think about what patriotism is, many of the things personal liberties are a good thing. Capitalism is a good thing. They're not the exact same thing as patriotism. Patriotism, when we think about it, is small sacrifices for the good of the community and the country. So in past times, you've had not just the people who fought World War II, but Rosie the Riveter, the person who didn't wear nylon stockings for 3 years because parachutes needed to be made, the person who drove around on retread tires because tank tracks needed to be utilized for the rubber, the person who bought the war bonds. Everybody gave a small sacrifice. Now, Nick Garcia and I were talking yesterday. Many people have given great sacrifices. They've gone without food because they're lost their job. They're healthcare heroes who've gotten sick. But what we're talking about, small sacrifices right now, not shopping and getting what you want for the holidays, but doing it in a safe way as possible. Not spending time with family, but doing it in a safe way through Zoom, foregoing those get-togethers just for now until the vaccine can get here and give its full effect. That's what patriotism is, because ultimately you'll be keeping your community and your country stronger by doing that. People have talked about the choice between shutting down the economy and following doctors' advice. And that is a false choice. I want to make sure you all know that. The doctors are only asking that we close or don't go to these loophole bars that are still open. That's the only business they're talking about shutting down for now. And it's not because the doctors hate bars. It's because the evidence is overwhelming that a bar setting is a COVID spreading event. You can be both safe and support businesses. You can shop locally and pick up your stuff curbside. It's also a false choice. I've heard people say, yeah, I hear what the doctors are saying, Judge, but my mental health dictates that I've got to balance my mental health with not going and eating inside of a restaurant. It is not going to damage anyone's mental health to eat on the patio with a heater, or to pick up their food curbside, or to pick up their food for delivery. Your mental health will survive without you going to a bar. Similarly, and it's painful, and I hate it because I love the holidays, our mental health will be survive us following the doctor's advice, seeing the family on Zoom, finding that way to get through the holidays in a way that keeps us safe from COVID. These are not mutually exclusive things. In fact, they go together, because what would be most damaging to our mental health is if our event gave a loved one COVID, or if we ourselves were struggling with COVID. So the key to that is planning ahead, thinking ahead. Don't let the holidays happen to you where the kids are sitting around with nothing to do because they can't go do all the things that they normally did. Think ahead to those fun things that you can do together, but that are safe. Now this week, we got a much needed boost to our efforts in the battle against COVID-19 as we witnessed healthcare heroes in Dallas County, North Texas, and really throughout the country get their first shots of the vaccine. It's a moment we've long looked forward to and anticipated, and what a relief it is to finally have that vaccine available to our healthcare heroes. I expect that hundreds of thousands of our healthcare personnel and nursing home residents in North Texas will receive the vaccine just by year's end, okay? And it may be a while, though, before you and I get the vaccine, before our number is up to get the vaccine, that is. Now, Dr. Wong will speak more about where we are with the vaccine and the general timeline of what to expect, but please know that we will follow the CDC and state guidelines and prioritize those most at risk, and then most importantly, ensure that the process is equitable. Those on the front lines fighting this virus and those most at risk for developing serious illness from the virus are the first ones that will get the vaccines. While I have not yet taken the vaccine because I'm not yet eligible in the tiers to do so, I will take the vaccine without hesitation, and I will take it publicly when my tier of risk is called. And why wouldn't I? This vaccine is safe, it's effective, it's 95% effective in you not getting the COVID virus after you've had the vaccine. And the side effects of the vaccine are very small. It's essentially people who had a pre-existing, and most of them already know this, they have allergic reactions to stable agents and vaccines. You may have an allergic reaction to one of these stable agents, and so you should check with your healthcare provider before getting the vaccine if you have had an allergic reaction to a vaccine before. Now, with the good news and recommendations from the panel late yesterday that Moderna's vaccine will be authorized for emergency use, we're expecting that even more vaccine will be available for our Dallas County residents in the coming days. Dallas County Health and Human Services will receive 1,200 doses next week and will vaccinate EMS personnel at our cities and other frontline medical personnel. We will make sure that the distribution of the vaccine is done equitably, taking into account communities who have suffered most and disproportionately been affected by COVID infection, taking into account the people at the highest risk, and ensuring that it goes out equitably, not based on who you know or whether you have insurance. By the way, a couple of things to know about the vaccine. Phil may cover these too, but people ask me, how much will the vaccine cost me if I don't have insurance? The answer is the same for everyone. The answer is zero. The vaccine is free. The federal government is paying the full freight for the vaccine. People ask me, well, what is the chance of, I'm afraid to get the vaccine because I've gotten a vaccine before for something else, and then I got that illness, and I think the vaccine caused me to get the illness. These vaccines cannot get you ill because these vaccines, and Phil may explain this more from the doctor perspective, they are protein replicators. There's no dead virus or live virus in the vaccine. The vaccine just prepares your body for if the COVID virus gets to you, this protein will wrap around it and make it ineffective. So that you cannot get the virus from the vaccines because there's no virus in the vaccines. Now, getting back to normal, and we're going to do that, guys. 2020, we're going to get back to normal. We're going to get through this. We're going to get back to normal. We're going to get back to doing the things that we love to do. But that's going to require all the tools in the toolbox, everything that we have at our disposal being used. Okay, you've already got 2 vaccines right now. This mask is a vaccine type protection, and your good common sense in following the doctor's recommendations is that. And now, while we've had some good news from with the vaccine coming, we're in a very dangerous situation right now with COVID-19. And while it appears many people heeded the advice at Thanksgiving to limit their activities to just people in their household, we're now seeing the effects of those who did not. For the state of Texas, a record number of 16,864 new COVID cases were reported yesterday. Now, that's the first time we've gotten above 16,000, okay? And we were almost to 17,000. COVID hospitalizations in the state are up to 9,600 people, okay? Just a quick fact on that, 20% of the people who are in the hospital statistically will end up in the ICU, and 25 to 50% of those folks will not successfully make it through their ICU stay. So the stakes are very high right now in the state and in North Texas. In fact, let me give you some quick stats from North Texas. For the region, a record high 2,859 patients are hospitalized in North Texas right now, that's gone up 85% since November 1. Okay, for instance, Collin and Denton counties have each reported more new cases in the past month than in April, May, June, July, and August combined. And in Dallas and Tarrant counties, we've seen record numbers of new COVID cases and hospitalizations just this week. As of today, there are 867 patients hospitalized with COVID in Dallas County, nearly 30 more people than our previous high of 838 people that we saw just 2 days ago. Now, this is a 45% increase since I spoke to you at our last press conference for Dallas County. We are also concerned that of these patients, about a third of our patients right now are ending up in ICU, and a fifth of those on ventilators. Dr. Wong will provide additional information about these concerning hospital trends. We're now averaging 1,600 cases a day here in Dallas County, our highest average since the start of the pandemic, and last week was our deadliest week on record with 105 reported cases. Our healthcare system is stretched. Our healthcare heroes are tired and stressed. They've been working tirelessly for this community since March. And unlike the spring and summer surges, the ability to draw on regional capacity and additional staff is extremely limited this time. So a post-holiday surge on top of the current increases could be, and hospitals say would be, devastating to our already heavily burdened healthcare providers. It's not a position we wanted to be in. It's not a position that anyone is happy about entering the winter holidays. While we're all tired of COVID, unfortunately the virus does not care and is not tired of us. Now, UT has updated their modeling slides yesterday and have predicted that and let me show you that. Here we go. It's over here. And what they're showing is that hospitalizations in Dallas County will remain elevated and possibly reach over 1,000 hospitalized patients by December 29th. They predict we'll continue to have an extremely high number of new COVID cases per day as well. Now, on this next slide, from UT Southwestern, that illustrates the continuing increase in the number of people testing positive for COVID. We want to see this number going down, not creeping back up to our summer highs. The number of individual hospitalized in our region is extremely concerning, about 40% higher than our summer highs as well. As you can see, and we must recognize that the numbers are going against us once again, so we must tighten up our behavior to get through this moment. People ask me, well, I've been going to the grocery store and going up and down the aisles since this began. Why are the doctors and you recommending that I do curbside now? Because the numbers are going up, and because statistically there are more people in the grocery store now or the mall now than there were in July or another month when you were there. And so they're asking us to think ahead and do that now in this time of high spread. So you should plan ahead as much as possible. If you can limit your trips for groceries and gifts, that's very helpful. If you can pick them up online or curbside, that's even better, and will keep you and your loved ones and ultimately our community and country a little safer. So again, now is the time to make those small sacrifices to keep our community and our country strong at this time of unprecedented spread, and while we await the herd immunity that will come from the vast majority of us getting the vaccine. I want to wish everyone, I'm turning over the field, but I want to wish everyone a very happy and meaningful and joyous holiday. I'm practicing, as I said, intentional thankfulness, and I'm thankful for all of you and for all of the heroes who have stepped up, the healthcare heroes, the first responders, our Dallas County and city staffs who've stepped up to keep us safe. Let's all do everything we can to do our part, our patriotic duty to help keep our community and our country safe during this time of high spread. And with that, I'll turn it over to Dr. Huang.
Thank you, Judge. So I'll give up follow up with some of the details on the numbers. We will be reporting today 2,258 new cases and 10 deaths. If I could get the slides. We remain obviously in the red zone. As the judge mentioned, availability of ICU beds remains very low. For Dallas County, our latest number is 32 ICU beds available in the community. Again, this is a number that we don't want to be going down. Next slide is the emergency department visits in the prior 24 hours. Again, this reflects some of the best of what's happened throughout the entire pandemic. One of the things, when we met with the modelers in the hospitals this week, that we did see is that fortunately Thanksgiving was not as bad as it could have been. We appreciate the communities, really accepting that it's not going to be a regular holiday. And so we saw a slight flattening out rather than the big increases. But the problem is we're really still at some record numbers, and I'll show you some more of that right now. So it's still very precarious. In the last couple of days, we saw some increases in the numbers that are worrisome. And again, we're starting out at such a high place now that this is why it's very concerning and alarming, especially to the hospitals. But we did, as a community, seem to do fairly well during Thanksgiving, better than it could have been, is what I want to say. But that's no reason to relax at all. Next slide is, these are the confirmed admissions in the prior 24 hours. And again, this is one that you can see now in the most recent several days starting to tick back up again. Next slide is the occupancy. And this is, again, you can see we saw some flattening out in the last couple weeks right before Thanksgiving, but we're at record highs. As we've been saying, these hospital numbers, the census numbers, are even higher than what we saw in July and midsummer. And now that's our starting point, and we're still going up. And the last couple of days, we're seeing some uptakes, which are very concerning. Next slide. This is the deaths. There's some lag time before we get all of the data, but we saw some increases up into mid-November. We're not sure if there's going to be catching up with some of these numbers as the deaths continue to get reported. But what's very concerning is certainly with the record numbers that we're seeing in some of these other indicators, the deaths can be a trailing indicator. And just a couple days ago, we had 30-plus deaths, which is extremely just tragic. Next slide. Want to talk about the vaccine and where we are. This is very exciting. It's an amazing scientific accomplishment, but it's also, it shows us a light at the end of the tunnel. But we want to really emphasize this does not mean that we can let our guard down or relax. These are some of the leading vaccine products that are in line to be approved or have already been approved. Last week was the Pfizer vaccine. It's the one that requires the ultra-low freezers. The dosage is a 2-dose regimen at 0 and 21 days. The Moderna vaccine was just approved by FDA last night, and the CDC advisory committee's reviewing that as we speak. It's what's different is it doesn't require those ultra-cold freezers, but just it can be stored frozen, regular freezers for 6 months, and then refrigerated lasts for 30 days. So it makes it a little easier to handle and manage the delivery. Again, it's a 2-dose, and this time is 0 and 28 days later. The other products, there's the AstraZeneca and Johnson & Johnson products that are coming up that we hope will be submitting their applications to FDA shortly. The one thing to note, the Johnson & Johnson product is the only one that really is a single dose, or it's being reviewed as a single dose, we believe, and that will be certainly help with some of the administration and the logistics. Next slide. As the judge mentioned, the delivery of the vaccine, the guiding principles, bottom line, fair and equitably that these are distributed. These are from the state health department, the guiding principles. But again, protecting healthcare workers initially, frontline workers, vulnerable populations, mitigating health inequities, being data-driven in our allocations, look for geographic diversity and transparency throughout this. And so these are, again, to be fair and equitable, are the guiding principles for what's going on with this. Just the next slide. These are the top tiers that the state health department has a advisory committee that's making and refining these recommendations for who should get it first. Thus far they've done 2 tiers on phase 1A. And these are the groups now that are currently receiving vaccine. I'll give a brief summary just where we are after this first week. I mean, it's just been a whirlwind, but already a lot's been done. So it's the hospital workers that are first, long-term care staff and residents, EMS providers engaging in 911 emergency services, and home health workers, including hospice care, are in that tier 1 group. Now this is, again, there's an expert advisory committee advising the state that's making these recommendations. If I can get the next slide. This is the tier 2 of this same phase 1A. They made a slight update to it. This was just hot off the press that we saw in a presentation right before this this press conference. So, this gets into the outpatient physicians and care settings. What they added was healthcare workers in corrections and detention facilities as part of this specifically. But again, the staff in emergency medical care facilities, urgent care facilities, the community pharmacy staff that are working on vaccination and testing, public health and emergency response staff that are doing the testing and vaccination, the last responders that are like the medical examiner's office and others that will provide mortuary or death services, and then school nurses who provide health care to students and teachers. And so the team, the advisory committee, is expected to then provide additional guidance in the next few days for the next phase. That'll get into phase 1C and 2. And so those are the guidance that's directing sort of the bigger picture guidance, and for the allocations, it's coming from the state. We have our own expert group locally that provided more even granular recommendations, like within healthcare providers, if there's limited supplies, which ones in the hospital should get that more first. And those things are also out there. And next slide. Just the timeline to expect. And if this all changes every single day based on right now we only have 1 approved vaccine. By the end of the weekend, we anticipate we will probably have the Moderna vaccine also approved, and that will change the supply. But right now, I mean, to expect that, and what we've been in is in the phase 0, trying to recruit all the providers. Right now, currently, we have over 560 providers in just Dallas County alone that have signed up, including pharmacies and individual providers. The next phase is where we are now, December to January, where there's limited supply of vaccine, but they're being direct shipped. You heard Methodist Hospital was one of the first 4 hospitals in the state that received vaccine this week. And then Parkland, UT Southwestern, THR received some on Tuesday. I'll have a little bit, just a graphic to show some of that. So that's where we are, and I'll talk about that. Phase 2, then from February to July, as there's increased numbers of vaccine doses available, as the Moderna vaccine becomes available, anticipating, then that's when we get into more of the phase 1B, 1C. And then phase 3, it's not expected right now that there would be availability for the general public until like July to October. Again, this can change as more products become available, but the point is, it's going to take a while to get through and vaccinate even these top tiers. And so the expectations to really, emphasize it's not going to solve this immediately. And that's why, as the judge said, we really need to keep doing all the other things. Wear the mask, avoid crowds, stay 6 foot distant, wash your hands. And then, again, after October, we anticipate sufficient supply, and the demand has been met. Just a few last things. One part, we're having regular meetings with the state, with the federal partners, with our local cities, with the hospitals, the other providers, with the FQHCs. And the pharmacies are also another key part of the strategy for this, getting the vaccine out. They are, at the federal level, there's part of Walgreens and CVS are part of the group that's going to specifically be working on long-term care facilities. But then also all the provider outlets that they have at their pharmacies are going to be part of the more general distribution, but they're also helping with some of these other higher tier groups and getting the vaccination out. But I wanted to acknowledge the groups. So just last, I think, next to last, just really, it's been a whirlwind just even the last week. If you think it was just a week ago, FDA approved the emergency use authorization for the Pfizer vaccine. The next day, the CDC Advisory Committee on Immunization Practice had their emergency meeting and approved it. December 13th, they issued the recommendations that it should be for persons 16 and older, 2 doses. And then that's when they shipped the first vaccine. Monday, it's only been Monday that we got our first vaccine. Then 4 hospitals received that first day, as I mentioned. Methodist Dallas was one of those 4. Then the next day, Tuesday, 19 additional hospitals, including the ones I mentioned here in Dallas. And then this week, the rest of this week, 87 additional hospitals have been receiving the vaccine. So it's been a whirlwind. Last slide. And this shows some of the vaccine allocations in week 1, just that initial distribution of how it looks across the state. Again, so this first week, there were 111 sites and 207,000 doses shipped to Texas in week 1. Next week, it's anticipated for the Pfizer. There's going to be the Pfizer vaccine probably going to long-term care facilities through some of the pharmacy partnership. And in week 2, the number, again, this week there were 111 sites. Next week, it's going to go up to 1,100 sites in Texas that are getting vaccine. And I think for Dallas County, this first week we've had about 32,175 doses shipped is the latest information that I have. But as you can see, it's a whirlwind. A lot's going on, and it's continuing to increase. The partnerships with everyone to make this successful have been tremendous, but it's going to take everyone working on this. And again, don't relax, though, but it gives us a light at the end of the tunnel. So thank you all, and happy holidays.
Hey, Dr. Wong, you said Thanksgiving was not as bad as it could have been, but we're still seeing record high numbers. Is there anything in the data that kind of points to any sort of behavior specifically that is different than in previous surges?
Well, certainly, the mask usage, the messaging of people not celebrating in the traditional ways, I think there's a lot more of that than certainly prior Thanksgivings. I think a lot of people are modifying what they're doing and trying to be safe, and certainly the mask usage. Hopefully it's being seen, recognized, as the judge mentioned. It's not a political thing. This is, the CDC's updated and increased their recommendations, and so these are, important, and they make a difference. I mean, that's the thing. We've shown when we do these things, we can slow down the spread. We know what to do. We just need to do it.
Right, but if it wasn't Thanksgiving per se that's contributing to these record high numbers, what actions are? Is there a new trend here that you're seeing coming from the data? I'm thinking in the early days it was congregate settings. Over the summer and fall it was younger people, right? Not totally, but is there a new trend here you're seeing?
Sure. The question is, what are we seeing from the Thanksgiving that maybe contributed to that? I mean, there's the modelers, we and the hospitals, we had some discussions about that. A couple things. One, that that some of the people, the kids being off of school, if those that are in school in person, the universities, some of the holiday, activity decreased perhaps some more interactions that may have slowed down some of the transmission that way. Also, I mean, there was some looking at, what are the demographics of where we're seeing more activity and less so there was some speculation regarding, early on in the outbreak, it was the people who were doing international travel and things like that caused it, then it became into the general population, that perhaps there might be some differences in that. The general population maybe not slowing down, staying home more, but you might be seeing some of the people who do more travel or international travel, they're maybe doing that a little bit more over the holidays, but we're still, interpreting all that.
You said you're down to 32 beds in Dallas County. Where does that number stand historically? Is that the lowest you've been down? And if so, if you go under the 32, what are some of the things that you plan to do if you run out of beds?
Well, I don't know exactly if that's the lowest. It's certainly on that chart that we showed. It's continuing to be very low. Now, the hospitals have their surge plans and have surge things that they could do, convert some areas into places where people could be cared for in an ICU type setting. So there are surge plans that they have, and I defer to probably the hospitals regarding specifically how they're responding. But we're all monitoring. We're all very alarmed at it. The numbers, if they go up further, it will be even more critical. And we're starting it at such a high load that it's very critical. There are surge plans that they all have in place when the numbers even get more critically low. But it's still serious, very serious.
Judge, it would be a point that maybe considering open up the convention center as that it was planned at the beginning, because we're running low on beds. I just wanted to know what's the plan beside the hospitals.
So the question was, would we consider reopening the convention center since we are running so low on beds in the hospitals? The short answer to that would be no. What they found when they did that, opened the Javits Center and other places in other jurisdictions, is that didn't work very well. So we probably won't be trying that here. What Phil was talking about a moment ago with hospital plans, I'll give you an example of that. We have surgery suites that can be turned into ICUs, stopping surgeries there and turning those rooms with all of their, special accoutrements for taking care of people in dire need into ICU suites. And then within our hospitals, you go to Parkland or Baylor or what have you, you'll be in a private room by yourself. But even the newest hospitals like Parkland and Clements are built for double occupancy rooms. And so there'll be an opportunity there to double up. Now that doesn't help you as much on ICU vent capacity. On ICU vent capacity, it's a real challenge. And look, the way it works with our healthcare heroes is if they're in a situation where they have to have people stacked on top of one another, they'll find a way to make it work. But people should not be under the illusion that the care can be as good if we are far over capacity, normal capacity in our ICUs and our hospitals. There is some trade-off there. And it's not just about getting a bed or a ventilator. It's about the human beings that are required to be around-the-clock help for that very sick ICU patient. And as we talked about earlier, there is a nationwide surge now. Healthcare heroes are exhausted. There are not healthcare heroes on the sidelines who are not already working more than their normal shifts. And so if the numbers keep going up, then the ability to care for people is compromised. And so we don't want that to happen. That's why we're all in it together. That's why when we talk about patriotism and everybody doing their part, the front line are those healthcare heroes at the hospital or those people that are taking care of folks in congregate settings at the jail or the nursing home. But all of us have a role to play in making smart decisions and being just a little bit better. It's important also as we do this not to look at our neighbor and say our neighbor is having guests over or our neighbor is doing whatever our neighbor is doing, and shame on him. We can't control our neighbor. we've got to look inside and say, what can I and my family or my business, my peer group do incrementally to get just a little bit safer? Perhaps someone is going to spin class or Zumba or something, and they say, I think I'll go ahead and take that doctor advice that's out there to work out outdoors. That'll help. Or they go, we talked about the people that go to the grocery store, if they'll pick it up curbside, that'll help.
I'm sorry, I'm gonna go back to the hospital bed, Judge. Do we have any guess of how many beds can we add in case we are like 30 or I don't remember the exact amounts we got beds available, but if we get to a point that we have 0 available, do we have any guess of how many can we add at a hospital?
The hospital council probably has that, and we can get back with you on that. But I know, for instance, at Parkland, what we did early on when we had that concern is we stopped all elective surgery, essentially. Now, I don't think we'll have to do that again. And by the way, elective surgery includes cancer surgery and, horrible pain, back pain that's keeping people awake all night surgery. It's not just, what a choice, a total, aesthetic choice or something surgery. So, but we stopped that then, and we can stop a lot of surgeries now and use those suites. Those suites can easily be converted into ICU. And you can do that across the systems, whether it be Medical City or UT Southwestern or whatever. So that's a deal that they'll have. And they have a certain number of beds. I don't know what it is as we sit here on that. By the way, the question, I forgot to repeat the question. The question was, well, how many number of beds can be added, if we do that. Remember also, though, when we talk about beds and ventilators, that was adding space for a person to lay down in a bed. That did not in and of itself create another nurse who is skilled at the ICU who, can do that. So you've either got people who are coming in, I hate to use sports analogies, but coming in who don't normally do that, playing out of position, if you will, because someone is unable to do it. You've either got that happening, or you've got that nurse who is at their position of ICU nurse now having more patients than he or she normally would have, and that is a challenge for patient care as well. Any other questions? Thank you all so much, and I do hope that each of you have a very happy holidays. I very much appreciate the work that the media has done in getting the important information out to the public. I think you are some of the heroes in this response, and I really I want to single you out and thank you for that today as well. And to everyone, if there are people still tuned in, God bless all of you and have a joyous and meaningful holiday.
Okay.
Would you decide whether you're going to send those graphics out, or should I shoot them off the screen?